If general practice is the bedrock of the NHS, which it is, then we need to have a general practice workforce that is able to deal with the changes, and some radical changes have already taken place, and we're in the midst of it.
The main workforce challenge is two really. If I could split it into two sides, there's the training side, and that is actually getting the right jobs for the scheme, so that people do appropriate hospital jobs in their 18 months hospital medicine, which are relevant and are of good enough standard to prepare them to become a general practitioner. The other problem on the training side is just finding sufficient training places in practices. Although we have 550 trainers in my part of the world, we still find it very difficult to find sufficient places for everybody to train.
We need to make general practice more attractive. Why are people not wanting to go into partnerships or even into salaried jobs? A lot of them are settling for doing locums because they don't know the future of their job role.
I'm actually representing general practice nursing and general practice nursing education in particular. It was really helpful to be invited along here to give that nursing perspective, because the general practice nurses are a really key part of the delivery team within general practice.
Well, I think it's the opportunity to see workforce planning in action. The use of workforce planning as a technique has actually been dying out in the private sector. This is partly because the kind of information that you need in order to be able to predict just isn't available anymore. We're fortunate in the NHS because we have standardised data sets, and these have been put to fantastic use in the construction of this model. So for me, as an expert in human resource management, the opportunity to see a really good piece of workforce planning was great. I really enjoyed it.
There is enormous frustration alongside great satisfaction in some settings with the way in which GP services are set up. In particular, there is enormous frustration about the difficulties in securing access to GP services, and I think that's particularly pressing when I think of the working population.
I think the NHS as a whole is going through massive reform, and a lot of that's going to fall to primary care with the changes to the way healthcare is commissioned. That, coupled with the changing demographic that primary care is having to manage, so the ageing population and the increased number of long-term conditions that they have, those are the main challenges. And GPs would probably say to you, having to deliver more with less.
With regards to the trainees, we still have a problem with regards to filling all our places. This is the first year that we've been able to do so, and long may it last, but there is still an anxiety that people may decide to march with their feet and move away from general practice. So we're reluctant to keep increasing the number of places, only to find there aren't the people to fill them.
I think looking forward, clearly we have a big demographic challenge ahead, and what we're going to need to do is to reconfigure, redesign together a model of general practice which can be as much about health promotion, prevention of disease, as looking after the inevitable increasing burden of long-term conditions.
Delivering primary care isn't all about what GPs can deliver. I think general practice has to be considered as a workforce that delivers the care that's needed by the local population, and that can be delivered. I think nurses have a role to play. They deliver a different part of the healthcare agenda. We know currently that practice nurses deliver 70% of the quality and outcomes framework in general practice. So I think if we're looking at what workforce is needed in the future, we need to focus on who can best deliver that within the funding envelope that's available, and nurses and healthcare assistants have a big part to play in that.
From a CCG point of view, is having a workforce that is engaged in the process, and for them to be engaged, they need to have some headroom. And for them to have that headroom, they need to be able to be in control of their workload, they need to be able to have a strategic view on things, they need to start to appreciate what population health means. So they need to have a development in their outlook and developing in their strategic outlook before they can start getting really involved in commissioning. The second is about developing them as leaders. So leadership as part of every every general practitioner in whatever they do, and then leadership within the CCG in terms of succession planning, in terms of actually getting on and doing some of the transformational things. So it's not about attending meetings, it's about leading processes, leading programs, achieving outcomes. So these are the spectrum of things that are challenging us at the moment. So we have to start by seeing how we can change the workload of general practice so that they can be more satisfied with what they're doing and appreciate the outcomes they're delivering, but also in terms of how can we make it better for them to help them deliver some of the outcomes for us from a CCG point of view.